Everybody.
Welcome back to Medical Monday.
Medical Monday it is. And this week we are talking about something that many of us at many different ages actually deal with, and that is degenerative joint disease. Degenerative joint disease.
One of the most common reasons to go see a primary care, and one of the most common problems that people have are back pain, as you see here.
Yep.
But that's one of the things we specialize in. And it's not just the back, though.
No.
Degenerative joint disease is with any joint.
Any joint. Look, it could be the shoulder.
Yep. Oh, we got a knee over here.
It could be the knee. It could be any movable joint. It's typically caused by trauma. Typically, some type of an injury, whether it be from sports or just overuse. So there's a lot of different ways that can cause it. But any joint in your body that moves can have degenerative joint disease.
And we talk about those big joints like the knee, the shoulder, the back. There's multiple joints. I mean, you look at the models back here. There's so many joints and so many problems that we can have because they are all, unfortunately, kind of built the same way. And it's not a very efficient system, and it leads to deterioration or degeneration.
Correct.
Yep.
Yes. And that process is called, essentially osteoarthritis.
Yep.
That's what happens. There's a lot of things that can cause it, like we've been discussing. But one of the biggest things is actually lack of movement.
Correct.
Lack of movement.
If right here, this is a healthy joint space, and you see it's encapsulated. There's no blood flow in there, but it's very healthy. It's got healthy fluid. That fluid needs to have pressure on it to exchange nutrients to keep the fluid healthy so it maintains that joint space and the cartilage healthy also. Now, with no movement, there's no pressure on the joint space and there's no exchange of nutrients. So therefore, that fluid gets very thick. It's more like sandpaper. And now you see it deteriorates or wears down the cartilage. Now, we're always wearing down our cartilage. We do activities and that's okay, but your body can heal as long as it's a good, healthy fluid in there. When we're not moving our joints, that's where we have most of the problems that can then progress even further to where you have pieces of the bone break off. We've got friends or family members, or maybe yourself had surgery in there, and they always talk about there's pieces, there's floating pieces. Sometimes that cartilage can break off in there, and that's a very, very serious prolonged injury that's not been fixed.
Correct. Yes. And one of the big things you mentioned is lack of movement, right? When that solution, that joint space, it has that fluid in there. So if you're not using that joint, the fluid just sits there and it doesn't pump. Our muscles are actually pumps. So that's why the big push is movement, get movement in that joint. Yes, I know it hurts. Get movement in that joint. It's part of that process to get it to heal properly and do what it needs to do there. So
I remember on the playground very early in age, whenever we would have an injury, what was the thing that we did? We walked it off. Like,
walk it off.
Just walk it off, it off. That doesn't help, but it does help to get movement within your joints. We don't want to not move them.
Did you write that song? Just walk it off.
Walk it off. No, I didn't. Not me.
One of the most common places that we actually see these degenerative change in the office is in the spine. So there's different phases, different aspects of the spine that can be affected, but this is just a great visual of how it can progress because it typically starts with some type of an injury or discomfort, and then we end up just not doing things for a long time, or we actually naturally avoid utilizing that joint space properly, and it just residually has an effect.
Deteriorates. Yeah. And it's the trauma that Dr. Gabby talks about can be just long-term sustained improper movement. So we have a spine here. At the very top, we're looking at good healthy disc and bones, everything structured and doing great, right? But as we get down to the bottom here, these spaces get less and less. Sometimes it's the pressure. Now, this back area, these are the bones on the back. When you touch your back, this is what you feel. They're very hard, solid bones because they're made to sustain weight. So that's why we have good posture. If we have bad posture and now the weight is on the forward part, like we're just leaning forward all the time, those discs are not for a cushion or weight bearing. They're for lubrication of the joint. They're so that you can move and do what you need to. When you start putting weight on them, they start deteriorating, and then that joint space is not good. And now the bone starts remodeling, as you see here. It just deteriorates over time.
It does, because that's the body's natural response to healing that, to dealing with that. That's just how the body goes, okay, I'll send more calcium there. Let's take care of it. And so that's exactly how this this process
Progresses.
occurs. Yeah. Yeah. Another very common area that most people can visually detect and see in friends and neighbors and just walking through the grocery store is in the hands.
Yep.
Very common place to get osteoarthritis. And these are called Herberdin's nodes.
And that's a good distinction. If you look at these Herberdin's nodes on a patient, oftentimes they ask, like, do I have rheumatoid arthritis? Do I have arthritis? What is it? This is what's going on.
Mm-hmm.
So these Herberdin nodes you see at the ends of the fingers more, and they're solid. So rheumatoid arthritis is actually an autoimmune disease, your body attacking the joint spaces, which makes them red, swollen, and sometimes soft. Very different than degeneration. Natural degeneration are very hard bones and nodules that are not red and are not tender. So the big difference.
Yeah, there is a big difference. And that's typically one of the big differences in between osteoarthritis, degenerative joint disease, what we're talking about, versus inflammatory autoimmune type responses.
With rheumatoid arthritis.
Yes, with the rheumatoid. Yeah. We've talked about this quite a bit, but what can we do at home, right? What can we do at home? And
keep the joint spaces healthy and happy. We have to
move.
Yes. Texas, get up and move.
I love this. This is actually
it's like a voting thing.
Yeah, this is a Move Texas, get out and vote.
I want you to get out and exercise.
Yes, that's what we want you to do, and we're in Texas, so I stole this.
The fall weather's here. It's beautiful outside.
Oh my gosh, yes. Everybody's going out to the parks and walking while they eat lunch. I mean, this is just, take advantage of it. I'm sure most of you actually feel better right now as well because of the weather change, so enjoy it. Get out and take advantage of it, because by doing that, it's actually going to prolong your ability to do more, right? So if you take advantage now, the weeks will last longer, the activities will last longer, and it'll get you ready for the winter and getting movement going.
Got to get movement.
Yes, got to get movement. Yeah. And the other big thing is bracing. Bracing is a great option. You can brace just about any joint in the body. I would not recommend the neck, but just.
So bracing is great though, Dr. Gabby. Bracing is, we want to move the joint space. The joint space needs to be moved, but sometimes with that joint space, it deteriorates over time. And now we've got some significant changes. I always utilize the knee as a good example. Your bone up top should come and your bone on the bottom. And now they should line up even. However, sometimes they can't. And now all the pressure's right here. What you want to do is brace it and open it up towards even pressure on that joint space. So bracing is great. It helps open up the joint space, but not restrict movement, because we need the movement.
Yes, you need the movement, but sometimes you just need that extra stability like he's talking about, and realignment. And that's what's great about bracing. There's a lot of different braces out there. And truthfully, you have to find out what works best for you, what fits your body type best, what feels best on you. And then also there's a transition where the bracing, you have to transition to getting comfortable with it. So you don't just put it on and wear it all day long and expect to feel good the next day. So there is a process of your body getting used to that and realigning to.
That's why a lot of times patients will go through 2 or 3 different braces to find the right one. It's got to be a comfortable fit for you. It's got to be something you're going to want to wear. If it's cumbersome, if there's too many straps, if it's just too difficult, patients sometimes will not use them. And they need to. So we've got to find a brace that's going to be comfortable for the patient and that they're going to use. Because if you don't use it, it's just not worth it.
It goes in that closet in the hallway like you have.
Like everything else, just sits in the closet.
And then another very common thing is arthritis rubs. There's so many topical rubs that exist out there. And again, it's similar to the braces. Find out what works best for you to get you the best relief. If you need sleep, find one that gets you the relief to get you through the night as you toss and turn and get through a great night's sleep. Or if you're trying to get through a tennis game or a golf game, or any type of sports, playing with the grandkids, lather it on, get through that process, get the movement going, and enjoy it, because it's about the endorphins.
A lot of the rubs, they have a heat feel to them, kind of a sensation. What that really does is just kind of increase the blood flow around the joint. You increase the blood flow around the joint, so as you move it and you put pressure on it, it exchanges nutrients. So you want to have as much of those around as possible. That's why you increase the blood flow around the joint space, so it can bring that joint what it needs to exchange to stay healthy and happy in there.
Yeah, that's very true. And so those are quite a few things you can do at home. The big one that we want you all to understand is move. Get up and move. We know it hurts. We know it hurts. We deal with it every day. Just get up and move. Just start with one. One is the loneliest number, but it's greater than 0. 0 movement is not so great, but one movement, one squat, one thing to just challenge yourself and get movement in that joint is going to make a huge difference. It truly will. So the next best thing, or not necessarily best thing, but the next step, typically,
next option that most patients do is,
Absolutely.
you've tried some pills or some creams at your local store, or, from a friend that you've heard about worked really good for them. You
Mhm.
ordered them and they just didn't really work that well for you. So
Yeah.
you need to go to a professional, and
Yep.
that's usually your primary care
Yep.
or urgent care, and they're going to give you what they know.
Yeah.
Oftentimes it deals with medications. So we looked at the arthritis rub. That arthritis rub that you can get from the store is not as good as the arthritis rubs that we know the FDA has approved. There's great medical studies on, such as Voltaren. Voltaren's a great arthritic rub because it's like liquid Motrin, but without the side effects of Motrin. Motrin's a pill that we take and eat through our stomach. We don't like taking that long term, but they develop Voltaren. Voltaren's a good gel you can put just on that joint space to where it helps kind of calm down that inflammation without the bad side effects, because that's always the problem with medications. If I take this pill, what's it going to cause? So, it just kind of adds up.
Yep, it is a lot of times a trickle effect, and we see that all the time in the office. But the good thing is that there are things out there that can be prescribed that don't cause that type of trickle effect, and they get great results directly where it's needed,
and only where it's needed.
Yeah,
not
and
everywhere
not
else.
just everywhere else. So that is a great option. One of the other things that happens is it's been in there for a while, or maybe the specific trauma that caused it, and so it's got to get scoped out. Sometimes it is a great option to just clean out that joint space. And so these are just different visuals of
this is luckily the new way of doing scope. So, before that ended, actually having to open up the whole joint space, and there's a big risk of infection. The new version with just a camera and a couple of instruments to go in and kind of clean out that cartilage that's deteriorated, or maybe there's floating pieces in there. It's very nice that surgery's changed so we don't have to open up the joint completely. They can use this called arthroscopic. They're using a scope to go in, so it's a much easier surgery as far as faster recovery and less pain afterwards for the patient. Yeah. And less risk of an infection.
Yeah. And like you said, recovery for these surgeries are significantly decreased compared to opening up that joint space and doing different things, such as what we see quite often is joint replacements.
If we just let it go and go without something, unfortunately, the orthopedic surgeons got to do what they got to do. You can't salvage what's not there. So they have to replace it with some hardware. And this, of course, is very painful and it's longer recovery, higher risk of infection. A lot of things that unfortunately go with when you put hardware in people.
Yeah. Very true. And what is awesome about this process, right? There's always some positives. We can replace hip replacements. We have knee replacements, but spinal replacements do not exist. So when you fuse the spine, there's no movement in those segments that are fused. So we just need to keep movement in the segments above and below to keep that process moving and keep the spine healthy. So there's great things that come out of it, right? Because typically they're needed. But sometimes the side effects and the responses are not to keep function there, right? We want to get you keeping that vitality
but you want to catch it early. It's all about early prevention. Early bird gets the worm, right? Well, same thing in healthcare. The early intervention gets the best results. And we do a couple of things specifically with those early interventions as far as trigger point injections. If the joint space is not healthy, and it's because the muscles may have locked down. Those muscles need to relax. Tight. Yeah, you want to relax those muscles, especially you get back spasms. A lot of times patients say, I got this knot, I got this spasm in my back. Well, that's the body's natural defense is locking down. However, your spine is a joint. It needs to move, so we've got to relax those muscles. Trigger points are a great option for that.
They are a great option. It's something we utilize quite often here. And then also PRP. Yep. We actually utilize your blood cells to inject into the joint space to get that lubrication back. Just like Lonnie said, there's no blood supply to the joint space itself or that fluid in there. So what this allows us to do is fertilize that joint space, really almost like a WD-40 effect. Just get movement in there again.
The great thing
make
about
it more comfortable.
The great thing is the reason why your joints are encapsulated because you don't want the red blood cells in there. That's bad for the joint space. As you see in this representation behind us, this is platelet-rich plasma. Now it's a full thing of blood, but it's been spun. See this bottom portion? That's the red blood cells. So they're taken out of the equation. Only thing we get is right here, this liquid gold. Transfer it over to a syringe and put just the nutrition in there. So you're getting the nutrition that you need, the lubrication, the healthiness put back into that joint space that it should have had, but we just can't because you get the red blood cells in there.
Yep. Exactly.
But we can separate the two and give you a healthy, happy joint.
Yeah. And then sometimes the progression's a little farther along, right? We have some of those significant degenerative change that exists. And so what we do is regenerative cells. So this is a slightly different process than the PRP, but the results are typically, I mean, great. You gotta regenerate that cartilage, right?
So it's
Get it back.
encapsulated. There's no blood flow. It's a nutrient poor environment. So unfortunately, your cartilage now looks more like Swiss cheese. It gets very, very soft. It gets very painful, like this knee here. And without your own body's cells in there to regrow that, it just continually deteriorates. So what we do is actually put cells in to where it can help your body now start doing what it needs to do. Your body needs to actually rebuild that cartilage, solidify all the holes that are in there so you can have comfort and movement.
Yeah, comfort and movement. And yeah, so those are some regenerative options or injection type options we have in the office. But then we also have rehab, right?
Yep.
When you get more comfortable with that knee, with that shoulder, we need to strengthen it, right? We've got to make sure that we keep that movement and strengthen it. So there's a lot of different options regarding rehab and making sure we keep that function and keep that movement going, whether we talk about ankles or knees or hips or the spine, right? We've got to keep that movement going. So there's a lot of different pieces of equipment we have in the office specialized and specific to getting that function back in those different joints that we've talked about.
Definitely. You know, the joints don't move by themselves. They need a muscle to physically move them. So we want to move the joint. So how do we do that? We strengthen the muscles. You got to strengthen the muscles and make it comfortable for the patient so that they will move those joint spaces. So they'll be healthy, happy, and not deteriorate.
Yep. Want that function. We want that vitality. We also we talk about movement, right? Sometimes we need to open up the joint space, and decompression is a phenomenal option especially for the spine and hips, to just get movement in those joints, because sometimes they're just so close. We need to open that up and then relax it back, and then open that up and relax it back, and get those muscles and ligaments and tendons to start engaging properly and doing their job. So we do have some specialized equipment to actually get movement in those joint spaces specifically. And then also adjustments. It's very important as you get more confident on those knees to realign the spine so that we don't have side effects regarding the hips, the pelvis, the lumbar spine. So we do adjust and align, just like you rotate your tires when you get new tires, or maybe you just get 2 tires instead of 4. We got to rotate those so they continue to allow the car to drive straight. We want to make sure that we get the best function in those joints and keep them aligned. Similar to bracing, keeping it aligned and getting that function in there, but a totally different presentation and effect there. All right.
You do it with tools or the table.
Yeah,
There's a lot of good options. You know, we look at degenerative joint disease as something that just occurs with life, but it doesn't occur with movement of life. So those are the big distinction. And when patients say, well, it's just natural, it's just there, I'm old, that's not necessarily the case. You can see different patients at different ages, and it's significant difference. And it's not just them themselves, it's what they've done. So we want you to encourage you to move, do the things you can on your own, but we've talked about a bunch of other treatment options that are out there so that you will have all the information you need if you need to be treated. But what's the key?
Move.
So you don't need treatment, okay?
Yes,
but
just move.
All things for Medical Monday are to help you guys just understand your health and what you can do to empower yourself to be much healthier. Hope you guys enjoyed today's show, and we'll see you next week.
Hope you enjoyed it. We'll see you next week. Bye-bye now.